The voice of the drum calls. It sings a song of those who came before us and those to come. A song of survival and strength. A song of participation and voice. A song that calls us together. When we come together and participate in the 2010 census, we use this tool as the voice of all our Native people. Our voice. It is in our hands. 2010 census.
Welcome to this edition of the Native News Update on this Thursday, February 18th. I'm your host for today's program, Paul DeMain. Many of the stories right here can also be found at our website at IndianCountryNews.com, and here are the stories for the day from the Associated Press and other Native news sources. A pre-built medical clinic is finally on its way to the Cheyenne River Reservation community of Eagle Butte after weeks of delay. A moving company began the trip from Fort Bear on February 15th. The 26-room clinic had been ready to move since early January, but bad weather, including last month's ice storm, caused the delay. The storm and blizzard that followed left thousands on the reservation without water and electricity. The moving company was to complete the move by February 16th, and officials expect the clinic to be ready for use in about 2 weeks. The state of Virginia has granted official recognition of the Patawomeck Indians, the tribe of entertainer Wayne Newton. Newton visited the state capitol earlier this month to ask for recognition for the tribe. The Senate passed a resolution this Tuesday to grant state tribal recognition to the Patawomeck or the Patawomeck tribe, the Freelance Star reports. The resolution already was passed by the House and takes effect immediately. The state recognition gives the tribe a seat with the Virginia Council on Indians, but does not grant sovereignty. Newton and the Patawomeck chief Robert Greene told lawmakers the move would validate their identity and help them protect sacred burial grounds. And in our continued discussions on health care, we converse with Shoshone-Bannock tribal member Mark Trahant, who is back from his trip to Alaska as part of his Kaiser Fellowship, and who is ready to keep an eye on the Presidents Health Summitt coming up next week. Mark, can you tell me a little bit more about your trip to Alaska and what you learned up there about the issue of health care? Is it a big debate going on up there about what might or might not happen?
I think there's a lot of interest in what's going to happen. I toured the Alaska Native Medical Center, and it's a little confusing, but it's really two facilities in one. And unlike there's a lot of differences with the Indian health system in the 48. One of the biggest differences is all of the tribes and Native people in Alaska have contracted for health care. So there is no direct IHS presence. It's all regional health corporations. The center itself is split in half. It's half run, the hospital part's run by the Alaska Tribal Health Consortium, which is virtually every Native group in Alaska. The inpatient facility, which is more like a clinic, a very large clinic, is run by the South Central Foundation, which is the regional health foundation nonprofit from Cook Inlet region.
Does that idea about how that portion of the clinic's being run, you had talked earlier in the season a little bit about donations and fundraising through corporations. Is that an avenue that allows for, a timber corporation that's taking timber off of tribal land up there to make a contribution to the healthcare system?
Absolutely. In fact, the Indian Health Service only supplies about 45% of the costs of doing business for the Alaska Native Medical Center. The other money comes from Medicaid, insurance billing, everything else basically, and about 5%, but it's a growing percent, is foundation money. And I think they see that as a growth area.
Is there actual patient billing as well under that system? Because in the Indian Health Service clinics here, again, they're not set up for cash payments on a sliding scale and those kinds of. We had talked about that before too, about the treaty obligation, and anytime you begin to say that, well, we can charge someone because they're making $80,000 a year, it diminishes the treaty right.
Right.
Do they have any patient billing there?
That's the basic premise there. No co-pays, no fees of any kind. It's all because of the basic treaty right.
Okay.
And they acknowledge that's part of the deal. One difference, though, that's worth noting is that if you or I move off the reservation to Detroit, we're pretty well set to figure out our own health care. There may be an urban Indian clinic, and we may be able to go in and get some services, but really very little. If you move from a bush village into Anchorage, you're basically still covered. The whole state of Alaska is a service area. And so you don't have the same urban Indian issues that you do in the lower 48.
And is it a little more difficult to get services out in the bush? What do they do with that? Do they have little substations or clinics up on some of those communities as well?
They have substations. They fly in doctors. They've really pioneered the use of both telemedicine and telepharmacy, where the pharmacies are delivered electronically, and then someone actually puts it in the cap and hands it off. It's pretty interesting how they do that.
Gotcha. You're headed to Washington, D.C. for some kind of a health summit coming up. Can you tell me a little bit about that?
Well, I'm not going to cover it directly. I'm going to cover it remotely. But next week, the president's trying to bring everyone together for a health summit at the Blair House. It's going to be televised. He's bringing in hopefully all parties, including the Republicans, and just trying to get some push to get a health bill through. I think the one thing they have in their favor that they can kind of push on is these rising insurance costs. Some insurance companies have started to send out their bills for next year, and they're going up 30, 40%.
Right.
And that's a good argument why the status quo doesn't work.
Good. So you're hoping that this is a little bit of the call for transparency, because so much wheeling and dealing was done on the spot in the Senate for that bill.
Right, exactly. Although now the folks who are calling for transparency aren't as keen on it. They see it as grandstanding, so we'll see.
Well, it's easy to criticize it, and then we get called on the carpet. Do you see them coming out of any of this? Do you think we have health legislation of some kind, at least in pieces? And what's going to happen to the Indian Health Improvement Act, Healthcare Improvement Act?
I just put up a tweet this morning that suggested that it'd be great if the White House, hopefully they'll read this, would invite at least a tribal leader of some kind to that meeting, because somebody's got to be in there saying, the Indian Healthcare Improvement Act is a part of this healthcare reform too. We need it to go through. And hopefully they'll get that message.
Well, maybe we'll highlight your message and you be on call rather than remotely. They may want to fly you in there to tell them a little bit about what you've learned, because there's people that says the discussions we have been more substantial on healthcare and Indian healthcare that they've seen anywhere else. There's people that just say, hey, there's some great discussions here, great ideas. We need to get more people to talk about it.
I totally agree. This is a unique time.
All right, we'll keep in touch with you, Mark, and give us an update
okay.
when you hear something.
What? Very good.
All right, thanks.
And that is the latest roundup of news from Indian Country on this edition of the Native News Update. Thank you for joining with us, and stop by in again soon. Mugwe.